Women's Justice Center is a national, nonprofit, nonpartisan organization. We represent state officials in all three branches of government in all 50 states. We strive to uphold justice, offer second chances, and ensure safety and healthy communities. My name is Sarah Wurzberg, and I am the program director within the Behavioral Health Division at the Council of State Governments, or CSG Justice Center. I'm really pleased to welcome you here today, and thank you to everyone from across the country who's tuning in to the release of our latest crisis response resource called Expanding First Response, a Toolkit for Community Responder Programs. Americans typically call 911 when they're experiencing an emergency or in need of assistance. But in recent years, jurisdictions across the country have reimagined their approach to public safety. Rather than sending police or emergency medical services to every call, some communities have invested in community responder programs that deploy health professionals and staff trained in crisis response as first responders. This growing movement to establish community responder programs is an important opportunity for communities to rethink how they respond to people in crisis and ensure public safety. We're grateful to have an excellent partner on this project in Vital Strategies, who have helped produce the Expanding First Response Toolkit. We also want to thank our partners who have contributed to this, including the planning and active community responder programs around the country who took the time to speak with us, work on a video, webinars, questions and answers, and program highlights. You'll hear from 3 of these communities as part of the panel discussion. We also worked with a number of partners to help make this happen, including Rachel Bromberg from Reach Out Response Network, Jasmine Graves from Radical Imagination Strategies, Amos Irwin from Law Enforcement Action Partner, Betsy Pearl, who is at Center for American Progress. And I especially also want to highlight my CSG Justice Center colleagues who really helped make this possible. Amelia Vorpel, Darby Baham, Ruvi Lopez, Elizabeth Fleming, Ashton Tolles, and Dr. Aisha Delaney Brunzi. Today's event will be in 2 parts. First, I'm really excited to introduce you and walk through the new toolkit. Following the toolkit, we'll have a panelist with an all-star lineup from active community responder programs. This conversation will be led by Deanna King, who serves as the technical advisor of the overdose prevention program at Vital Strategies. Vital Strategies is a global health organization that believes every person should be protected by a strong public health system. Vital Strategies is helping a number of high-burden states in the United States strengthen and scale up evidence-based, data-driven interventions to reduce risks of overdose and save lives. Since joining the overdose prevention program, Deanna has established partnerships that have led to the development of innovative projects such as harm reduction service delivery units using medical vending machines, mobile outreach vehicles that will provide naloxone and other harm reduction supplies, and a toolkit for healthcare workers who support parenting and pregnant people who use drugs. Deanna has worked in the realms of public health and criminal justice policy and advocacy for several years. She is an alum of the New School, Florida A&M University, and is presently enrolled in Johns Hopkins Bloomberg School of Public Health. Before joining Vital Strategies, she worked at the Drug Policy Alliance, where she developed the foundation of the Race and Mass Criminalization Campaign. So community responder programs really position health professionals and community members trained in crisis response as first responders. These responders will respond in place of police to social disturbances, people who are unhoused, mental health, substance use, and overdose response crises. The number and qualifications of people hired for response teams really should be tailored to the community's distinct programming needs and constraints. These staff usually have varying levels of experience and expertise, ranging from nurses, behavioral health specialists, social workers, paramedics, peer support specialists, and community members trained in crisis de-escalation and intervention. The responders are also equipped to de-escalate situations and provide community service connections, as well as on-demand support to items such as food, water, clothing, and basic living resources as needed. Racial injustice and other systematic failures have really led to the development of many community responder programs. Years of nationwide disinvestment in community healthcare and social services have contributed to jurisdictions relying on police interactions, even when situations could better be handled by health or social service professionals. Advocacy and grassroots organization, government agencies, nonprofit service providers, and neighborhood collectives are working together and showing that investment in these programs can support the community and conserve public resources. Community responder programs are designed to be one component of a broader, coordinated response to people in need. They work best when implemented as part of a comprehensive, coordinated system informed by community crisis information, data, and led by a diverse group of community stakeholders. They often work best when built into a comprehensive system of community support so that after community responders address a call or respond to a call for service, they can provide immediate care, and they can also connect people to services like housing, treatment, benefits, employment, and other needed supports. Many existing programs have used needs assessment and asset mappings to identify the community's available resources and begin to build relationships with organizations and providers in the community. Ultimately, connecting people to these long-term resources can help reduce people's needs for crisis services. Finally, just a quick couple of housekeeping things, and then I will get to the fun part, which is the toolkit demonstration. We encourage you to join today's discussion with comments or questions. You can do this in two ways: on social media using the hashtag JusticeBriefingLive, or in the Vimeo comment boxes that you should see on your screen. Our team is standing by to respond. A recording and a transcript of today's event will be made available at csgjusticecenter.org in the coming days. And with that, let's dig into the toolkit. So I wanted to share my screen so I could just walk you through the toolkit and show you some of the features so you could get a feel for the information you could find here. So this is the homepage for the toolkit, and we really go over some of the basic informations about the issue. We have a link to a couple of quotes here. The first quote is from the Denver Police Chief, Paul Pazin, who talks about why this is really a necessary service and how it can really help connect people to the right service at the right time and really have people avoid justice system interaction. We have a short video that goes over how to use the toolkit and this issue as a whole, which you just heard some of that, and you'll hear a lot more from our awesome panelists. And the toolkit has 10 different sections, and all of the sections kind of have the same format. So really the toolkit is meant to be a hub and a central resource. And there's at least 2 different resources in each section, and it provides a snapshot of the issue, important things to consider for successful implementation, and different resources that you might want to consider. We also have a quote from another partner, Reverend Dr. Charles Boyer from Salvation and Social Justice in New Jersey, and he has helped to build community responder programs in both urban and rural areas in New Jersey. And the video of his team is something that you should definitely watch on the community engagement section. So these are the different issues that we're addressing in the toolkit, and these are some of the more commonly asked questions in planning and implementing the program. So there's a broader overview of community responder programs for people who are new to this issue. There's community engagement and collaboration, really talking about what that process has looked like in different communities. Needs assessment, so what do you need to know before you start planning the program? Thinking through program staffing, call triaging, data-informed decision-making, safety and wellness. So trying to answer the question of what many people has, is it safe to send a non-law enforcement professional to the scene or other trained community members? And then also getting at the need for staff wellness for community responders and first responders in general. We also talk about financial sustainability and legislative strategies. And then there's a program highlights section. So I'm going to show you two sections so you get a feel for the type of information that you can find. So within the staffing, which is one of the biggest questions, is how do people staff these? Is it always the same model? What does it look like? And we've really found a lot of differences from the sites that are working around the country. And one of the big differences is who's actually leading this effort. Is a service provider organization that might be healthcare based or not? It could be an existing government agency or a newly created government agency. So you can see for staffing, we have a couple of tips. So really thinking through who this lead agency is and who they need to engage to be able to develop the program, using information gathered by assessment and feedback to inform the staffing needs. So what is most important to your community? What are the gaps? Provide ongoing training for the community responder teams, and really thinking about how the lead agency can better support the needs of people and prices and help to expand the different resources. So within this section, we have a question and answer with Olympia's crisis response unit. You'll be hearing from one of their team members on the panel as well. And then there's also an explainer that breaks down different staffing structures and models of some of the active programs around the country to give a feel for the variety of types of professionals that are being sent as first responders. Then in each of these, there will be different research reports or other links that you can look for. So this is a resource on international crisis response training from the Reach Out Recovery Network. So just to show you a feel for one other section, you can see that the format is quite similar. You have the different considerations for the program. And then there is an explainer really focused, since this is on financial sustainability, on how to leverage Medicaid and the American Rescue Plan to support these programs. So these are two funding sources that have been expanded recently to provide additional opportunities to be able to help support these programs. And then there's also a brief that was written by Betsy Pearl that's really talking about financing of community responder programs in more depth than that article does. There's also links to other resources. So in the program's highlights section, you can see right now we just have one highlight, which is San Francisco Street Crisis Response Team. And this actually goes through each of the sections of the toolkit and provides some information. So for example, if you want to know how the San Francisco team handles call triaging, you would look in this section. An important thing to know is that we're going to actually be adding many more program highlights in the near future. So if you check back or if you sign up for our newsletter, you'll have more information about the programs as they come online. And then lastly, the acknowledgements. And I know I'd already mentioned a lot of people, but really this was a large effort to try to aggregate a lot of resources. And so just really want to acknowledge and thank our partners who helped writing, research, advising, and all of the active programs, 3 of whom will be featured on the panel, who've really contributed to this project. Okay, so I'm now going to pass it over to Deanna, who's going to lead us through an amazing panel.
Thank you, Sarah, for that introduction and walking through how the toolkit functions. It has been a pleasure to work with Sarah and a number of the partners on this panel and both producing and learning more information about the crisis response teams that they are operating or in the process of planning. So I'm just going to start by introducing each member of our panel, starting with Tim Black. Tim Black has been working for Cahoots as a crisis intervention worker since 2010, before moving into the administrative role as the Cahoots operation coordinator in 2015. His work with the White Bird Clinic and Cahoots has put him in touch with states across North America looking to implement services based on the Cahoots model of behavioral health first response. And I just want to shout out Tim, who has been an asset to everyone on this call and people throughout the country. I can't imagine how his phone was ringing as people were trying to learn more and more about this program. And he's met all those calls with grace and has been a valuable resource to everyone. So thank you, Tim. Next, I want to introduce Ann Larson. Ann is the Outreach Service Coordinator at the Olympia Police Department, where she manages the Crisis Response Unit and the Familiar Base Program, and she can share more about that as we go through the panel. I also want to say that Ann has the most beautiful data dashboard that I've ever seen, and I hope that there's more information about it in the toolkit. Next, I want to introduce Akila Sherrills. Akila is the head of New York Community Street Team, which is a community-based violence reduction initiative, which he co-created and directed at the request of New Jersey Mayor Ross Rock in 2014. In the 5 years since starting in CST, Akila has contributed to the work to reduce New York's homicide rates, which went from 104 in 2015 to 51 in 2019. He's also co-founder and leader of the Community-Based Safety Collective and serves as a senior advisor to the Alliance for Safety and Justice Shared Safety Initiative. And finally, I want to introduce Elizabeth E. Rubin, who is a pioneering policy expert and advocate on victim services, violence reduction, and public safety. She has successfully stimulated a shift from over-reliance on law enforcement for community safety to community-based, community-driven public safety. Thank you to our panel. And the first question is for Akila, Tim, or Ann. How and why are community responder programs an important part of crisis response in your community? And please describe your community responder program and how it works across systems in your community. So whomever wants to go first. Actually, I'll pass it to Akila to start. So we don't talk over each other.
Thank you so much, Deanna. And just a big shout out to CSG and Vital Strategies and all of our partners who supported making this work possible. Again, Akila Sherrills, the work that we do has been really phenomenal, right? In terms of developing non-law enforcement responses to violence in our respective community in the city of Newark. Traditionally, in the country, you say public safety and people say police. And the reality is that police are only one aspect of this public safety process. We believe that safety is a shared strategy, and residents and communities should be seen really as a constituent in that overall process. In 2014, when Mayor Ras Baraka was elected mayor, he tapped me out of Los Angeles to come into the city and build out his community-based public safety initiative, the Newark Community Street Team. We are a resident-driven, community-based response to violence in the neighborhood. We train residents as public safety professionals in conflict resolution, de-escalation strategies, trauma-informed approaches, to intervene, prevent, and treat violence as a public health issue. Through that public health frame, we understand that those who are closest in proximity to the violence in the neighborhood, right, should be equipped with the skills, the tools, and the resources to do the intervention, the prevention, and the treatment. And so over the past 5 years, NCST has implemented this three-pronged strategy of high-risk intervention, assertive outreach, and victims advocacy. And these three systems kind of like work together, to address violence and to mediate violence, to a peaceful outcome, right? Our high-risk intervention team utilizes an 800 number in which residents can call us directly to address loitering issues. We're also on the police dispatch in the city. So when law enforcement gets the notification around shooting and shooting hits, NCST also receives that notification. Our team responds to the scene. Our protocols doesn't allow us to cross the yellow line. That is law enforcement's domain. We utilize our relationships in the neighborhood with residents because our staff are essentially the very people that they serve. They talk to folks on the other side of the yellow line. They traditionally follow the survivors to the hospital, in which we launched the city's also first hospital-based violence intervention program. So we have 3 community health workers who are embedded in the trauma unit. Our high-risk intervention team works with them because there's a pretty high threshold in terms of arrest and prosecution, right? Law enforcement is not always able to collect enough evidence or get witnesses so that they can make an arrest. So and I like to utilize these terms of Pookie and Raheem, being victims and perpetrators of violence in neighborhood. When Raheem is coming home from the hospital and arrest hasn't been made, the community health worker and the high-risk interventionist develop a safety plan. They meet with the potential perpetrators and their associates in the neighborhood and mediate those conflicts so that individuals come back into safety and don't come back to the very circumstance that actually sent them into the hospital, right? We understand through the report that Law Enforcement Action Partnership has put out that something like 38 to 40% of 911 calls are serious or violent crimes. And so we believe that, that residents should be on the forefront of being able to respond to those types of issues. Most recently, we've partnered with Vital Strategies to develop a comprehensive plan to be able to respond to OD response in the neighborhood, because that has been such a huge issue that has contributed to violence in the neighborhood. E is going to talk more about the study that we actually put together, on that particular work. But we're really excited to be a part of this collective in terms of developing a comprehensive approach to violence reduction in the community with and without law enforcement.
Thank you, Akila. I'm going to pass it to Tim. Same question. Can you just tell us a little bit more about Cahoots and how does crisis response work within your community?
Yeah, so to start, Cahoots is an acronym that stands for Crisis Assistance, Helping Out on the Streets. And our founders back in '89, when the program first got started, I think also really recognized the need to illustrate, right out of the gate that as first responders, our obligation is to the person in crisis and to the larger community. As such, our crisis responders are in cahoots, with the people that are in crisis. But our teams have been serving in the community of Eugene and Springfield since 1989. Our crisis teams respond to all manner of situations that, really emerge from what we consider to be unmet needs, oriented around mental health, substance use and abuse, poverty, homelessness. I would even add in there, folks who've experienced violence and trauma, especially in their younger years. And the intention of this program is really to recognize that there are all manner of crisis situations that are occurring in our community for which there's a need for a first responder, but that first responder does not need to be somebody who's coming from a law enforcement perspective. There's not a broken leg or a heart attack, nothing's on fire, and so we don't need a paramedic or the fire department to come in. But in the absence of somebody who can come and address these situations, they can escalate until they get to the point where they do require that police intervention or that utilization of fire and EMS services. And so Cahoots is really about kind of that de-escalation and stabilization. Really, what was it that allowed that crisis to emerge in the first place? And what can we do to address what you're experiencing in that moment, meet some of those most urgent needs, and then find connections to the other resources that can prevent those triggers from occurring, that can allow those needs to go met in other ways, that can really help get folks connected, the kinds of supports that they need to really thrive and give back to their community. Within what Cahoots offers, I think it's also really important to recognize that we are only as successful as the larger system of which we are a part. And I know that there's going to be more time to talk about this later, but this is really where in our community with our crisis worker and EMT teams, our objective is to really find out what is it that we can get somebody connected to, who is it that we can really help this person get served by so that they don't need to lean on public safety, so that they're not calling 911 because they're in a housing crisis situation. There's a whole, we could spend hours really just kind of talking about the different call types that these teams are responding to. And I'm fighting the impulse not to dive into that right now. But ultimately, when we talk about these services, we really need to recognize the scope of the demand that's out there. In the city of Eugene in 2019, there were 105,000 calls that were placed to the public safety system. Cahoots teams were involved in over 18,000 of those responses. We did 15,000 of those without the assistance of police, fire, and EMS resources. And 13,000 of those calls would have required police, fire, and EMS to respond if Cahoots hadn't been available. And through all of that work, through all those contacts with folks in the community in desperate crisis situations, we only called for police cover 300 times. And for a program that costs $2.3 million a year to run, on all those dozens of thousands of calls for service, we ended up saving our community $17 million a year. So beyond the experience of the person in crisis, beyond the argument around public health, we also need to recognize that these types of services are cost effective. And that's what Cahoots is doing, is really, addressing not just the human impact of those unmet needs, but the financial burden that cities are taking on because they're not adequately responding to these crisis situations.
Thank you, Tim. Those numbers are incredible. Finally, Anne, do you want to tell us a little bit more about what's happening in Olympia?
Sure. I don't know if I really want to follow those two because it's pretty amazing, but I'm happy to chime in. So I was lucky enough to work really closely with Tim. Olympia is just about 5 hours north of Eugene, and Olympia has been up and running with their crisis response unit since April 1st of 2019. We're based heavily off of the Cahoots type model, where we have community responders responding to folks in crisis or distress in the city of Olympia. We are a town of 54,000, so folks on the call are wondering, like, do I have to be a huge town, or are there certain ways that this works? Really, you need to just cater it to the population that you serve. We have a really large houseless population in Olympia, and so our teams are really staffed with resources to address poverty. Is really one of the drivers for our contacts and calls for service in the community. So that means we carry hand warmers and survival gear and things that can really help shelter and secure and stabilize our community members. I think that the key for all of these programs is that we are responding. So we're the ones that are responding during COVID or during wildfires. We need to show up, and when someone's calling for us, that they can expect someone to show up and someone to respond quickly and be able to assess the situation and help them out. Really, my team is just like the most amazing problem solvers. As Tim alluded to, the calls for service just run the gamut. This morning, we helped a gentleman get a ticket to Amtrak, or an Amtrak ticket to get back home to Virginia. He told us all about the Titanic on the way to the Amtrak station, the plot of the movie Titanic from start to end. And it just really makes your heart smile that you're getting someone reconnected to where they need to go. Not an appropriate call for law enforcement and not an appropriate call for fire. So definitely an appropriate call for someone that just has a heart for this work. One of the things that I really gleaned from my time down in Cahoots was just when you see the magic happen in the Cahoots van, that you can make that magic happen in your community. And it's just hiring folks that have a passion for street outreach, having a passion for harm reduction and trauma-informed care, and just loving on people in your community. So I know we've got some other great questions that we're all going to get to answer. So I'll just leave it at that.
Thank you, Anne. And I remember when we met and we were looking through that beautiful data dashboard, just the sort of range of calls that you were responding to. Not only were they not in line with what a law enforcement call would require, but they were just so person-centered, and just like not all of them were about crises. They were just about meeting someone who had a particular need and needed someone to turn to. And I think it's beautiful that your response team is so flexible to allow that really person-centered sort of response. That's not just about referring people to a kind of treatment, but just giving them what they need. So second question is, what has changed for your program over the years as you move from planning to implementation and as things have continued to expand? And I'll start with Tim, since you have the most experience in this as of anyone on the call. How has Cahoots changed over the years?
I think the biggest thing for us has really been a shift from providers deciding what is going to be an effective model of intervention to really orienting our work around the lived experience of the people that we serve. Hands down, the biggest change that I've seen, not just in my 10 years, 11 years with the program, but what I've heard from my predecessors and the founders, is that what we see today with a much more overt recognition and celebration of the impact of our services and the experiences of the people that we serve in the form of a community advisory board. We're starting to identify where our program needs to change, where we've allowed bias to slip in, where we have created inaccessible services with through an intention to create something that was available to everybody. The fact that the only way to get a hold of Cahoots right now is to call the police non-emergency line is an indication of where we still need to go with regards to that community input. We are hearing from folks, especially, members of our BIPOC community who are saying that it is not safe for them to call a police number when they are in crisis. And so, with the rollout of 988, with a lot of the opportunity that has come along with the recognition of our program, we're really seeing a profound need and support from our funders to move towards a point of access that doesn't require that interaction with the criminal legal system in order to access care. The last thing that we want to do is associate help in these crisis situations with some sort of arbitration happening within law enforcement before that crisis service can go out there, right? That's why even in CIT International's best practices guide, they really caution against co-responder programs for the very reason that it sends the message that help can only come in that police car. So I think, for us, just trying to be a little succinct is that we have really made a concentrated effort to shift our focus and our values to align with the people that we serve. And that when we have seen that when programs aren't taking that time, especially in that planning and implementation phase, to really organize around the needs of community members, to uplift and find ways to recognize and value those perspectives, that those programs don't really work out, that we see folks needing to go back to the drawing board and completely start from scratch. And so, for us, the biggest thing is really just listening to the people that you serve. Find ways to center your work in that lived experience. Employ folks who have that lived experience, right? I think that's another thing for us is more and more of our responders are coming from a place that would, qualify them as peer support. And there's power that comes with that. Being able to say, look, I've walked this walk, right? I've been there. I've been in the scrubs. Let's see what we can do to prevent you from getting to the place that I ended up, and if we do end up there, well, hey, I've been there and I can help support you through that too.
Thank you, Tim. I'm going to pose the same question to Anne. What has changed through the years?
A lot, but just like Tim said, I think that all the changes are really rooted in just connecting continually with our staff in the community that we serve. And so because of hearing from our staff and really valuing our staff, we have switched from having them be contracted employees to being city employees. We've adjusted our partnerships. So we've got a satellite office like in the inner city transit station right now because we were responding to so many calls for service at our transit center. Our staff during COVID really, took a hit because a lot of social service providers and a lot of recovery supports had to switch their models, understanding that they needed to keep their staff safe, but it was really hard for our marginalized populations to understand why they had to stand outside the building and talk to somebody on the phone. Why couldn't they just go talk to the person? They needed to get their EBT card, the masking, all of those kinds of isolating situations really took a burden on our staff. And so one of the things I always just don't ever want to lose sight of is ask the people doing the work how to successfully do the work. I don't ever get in a discussion with my staff about buying a prescription for somebody. It's like, if that person needs a prescription, we're buying a prescription. And so really trusting the people doing the work to do the work has been really how our program has shifted and crafted throughout the years. We couldn't have an EMT like Tim's program just because of the way Washington laws work around EMTs. And don't let those kind of, if you get your mindset on something that you just need this to happen, you need to have a sobering center to make your program work, or you need to have an EMT on that bus or van to make the program work. It'll happen. What'll happen is the ERs will reach out to you and say, oh my gosh, you're bringing so many people to our ER. Can we give you a nurse to put on your van and help you divert calls for service in the community? So listening to the folks that you serve and listening to the folks serving those folks is really, I think, how you're going to see your programs transition throughout the years. And just don't get locked in on something because you wrote it down in a policy 3 years ago that this is how it was going to be. Just adapt and change.
Thank you. And I think that's one of the benefits of this being an emerging field. You're not constrained to any one way of doing things. You get to build based on what's happening. So I want to pose the next question to E and Tim. What advice would you give to people listening who are just considering or starting to build a community responder program? I know, E, you are in the process of developing the work at NCST, and that's just been an opportunity for a lot of flexibility and learning. So yeah, what would you share with the group?
Yeah, well, first of all, I'm soaking in the knowledge on this call, just listening to Ann and Tim. So this is amazing. And thank you, Deanna, and thanks to the Council of State Governments for having us here. So before I give you my kind of lessons learned, I did just want to take a moment to acknowledge that community responder work is not new, right? And that Black and Native and Brown communities have always responded to their own needs, and they were kind of gradually regulated out of the ability to do so, right? And so I'd like to pay homage to the first EMS in the country, which was the Freedom House Ambulance in Pittsburgh, which was Black run and was put out of business by local white fire departments. I think we got to acknowledge, when we talk about this work, we have to acknowledge the Young Lords, and we have to acknowledge the Black Panthers and all the organizations that were criminalized for meeting community health needs, right? And we're really like, in 1990, Flavor Flav said 911 is a joke because there was a sentiment that this was not working for a lot of communities. And now we're kind of collectively really realizing like, oh, we have to pivot. We have how we serve certain communities and respond to that. So anyway, I just wanted to acknowledge kind of the historical base that we are honored to emanate from. So as Akila talked about, we start out doing violence reduction work, but just over, our folks get called for everything, right? These are, again, we work in a community where people do not want to call 911. They do not have faith in institutions. And so we ended up responding to everything. So it kind of made sense to start evolving to be trained and resourced to actually meet needs besides addressing gun violence. So, and thank you for Vital Strategies for helping us with that. So what have we, and just at our heart, we're like a decolonization of the neighborhood model, right? We believe in investing in neighborhoods and in community itself and the residents to meet their own needs, to kind of go back to like what Freedom House was doing, that people can serve themselves. So what do we learn in this? I think my first advice is a program in its infancy would be to read the toolkit. Okay, like no joke, if I had a toolkit at the beginning, my life would have been a lot easier. So I wish it had, I'm glad that people have this resource now. There have been other efforts in Newark where we do a lot of our work to undertake a project like this. And they were generally large bodies that were just kind of, there wasn't clearly somebody in charge and nobody was funded to manage the process. So I would say that somebody has to be assigned, for those of you who are in planning phase, somebody has to be assigned to lead the process. And it really takes intense focus and follow through. And we were fortunate to have Vital Strategies support us in really leading that planning process and making sure that it kept going. Because like I said, this has been tried and failed before. I would talk to, the man's too busy, I know, but I would talk to Tim at Whitebird Clinic. And there's so many folks in the field who they're all overworked, but they are so committed to this work and just so generous with their time. So we spent a lot of time, we talked to folks in San Francisco. I'm sorry, we didn't get to talk to Anna earlier, who really guided us. So you need mentorship, and hopefully you can get a grant to pay them for their TTA time because people are overstretched. Anna alluded to this a little bit, like understanding the regulations that could impact your work. And I would say sometimes those regulations are real and sometimes they're perceived. We ran into a little bit of that. So going back to what I was talking about how the like Black and Brown and Native communities were kind of regulated out of sort of meeting their own needs. A lot of people operate from this assumption that community cannot do this stuff for themselves, right? We experienced that when we started in violence reduction work, and we've experienced it now that we're doing like OD and harm reduction work. It's like, oh no, y'all can't do that. It's like, so we always ask at NCSD, well, what's the policy? Show us what, because we ran into this, as Deanna, with law enforcement, police department saying, oh no, we have to, under their regs that say we have to show up at every call. We're like, well, can we see them? So we always, really, you have to understand your whole regulatory environment on all levels of government, and kind of to know how to do your work. I think to piggyback on something that Tim was saying before, when you do your community asset, you map your community assets, which is in the toolkit, and when you do you're listening to the community phases, you have to ask impacted people, right? So stakeholders are not always honest about service gaps. But if you ask the people who tap into those services, they will tell you like, oh, hell no, I will never go to that place, right? No, oh, they're terrible. They don't actually provide X, Y, and Z. But if you don't ask those folks, you know, you could sit in polite meetings and it's like, oh, well, so-and-so could do that work. But if you don't take the time to ask the people who are going to use the services, you're going to have major holes in your program. And then I think when you get launched, you need to document those gaps and hold people accountable. So if you're serving people who live in bandos, you got to go to a bando, right? And talk to those folks. Like you can't rely on kind of institutional meetings or meetings in the evening that are institutional spaces to gather the information that you need for your kind of understanding the community assessments. And I see that that's often a place that are kind of where people make a mistake. They just rely on other stakeholders to give them their intelligence. So those would be my top tips for your planning phase. And I'm happy to, you know, answer questions. Thanks for the opportunity.
Thank you, E. And to E's point, when we started planning the work for NCST, we were looking for resources on how to guide us. We realized there was not a lot out there. And so it was like, oh, but we should do a toolkit for this. So this is how this all came together. Same question to Tim.
Yeah, you know, I without just really reiterating everything that E has put out there, you know, if you're just getting started, I would ask, you know, who is it that you're trying to serve? Right. And once you've identified that, then who is already doing the work? You know, we are, you know, creatures of community, right? And so we try to fulfill needs for the people that we're connected to. And so, you know, if there's not that crisis center, you know, maybe there's that person who's got a porch that you can always go to for that listening ear, right? You know, maybe there's that person in the congregation that does a really good job of checking on folks if they've missed a service. You know, really connecting not just with the people who are in need, but the folks who are trying to fill those gaps in the larger system through whatever resources they have at their own disposal. You know, really, you know, broaden what you define as lived experience, but then also recognize that lived experience has value. Right, you know, E talked about these institutionalized, you know, right, every third Thursday evening at 6:30 meeting. Well, that's great if your work schedule accommodates you making it to that 6:30, you know, p.m. meeting every third Thursday, and you don't have to worry about childcare or cooking dinner. You know, there's so much more that folks can bring to the table and will be able to, you know, present when they feel like they're being invested in and when their perspective is being valued. And so, you know, in fact, there's a rural community here in Oregon that completely scrapped their first approach at mobile crisis because there wasn't enough lived experience. And because the people that were able to contribute that lived experience, you know, weren't getting compensated fairly. And so they were really limited in what they were able to do. They've taken a, you know, completely new direction. That lived experience is being valued, right? There are community advisory positions that are being created so that folks don't have to worry about the financial burden that comes with volunteering their time instead of working. So, you know, yeah, I guess, you know, really piggybacking on what you said, you know, really listen not just to who it is that you intend to serve with these programs, ask where the needs are, and then ask who's helping in the absence of more traditional resources.
Thank you, Tim. I want to leave some time for questions. I'm going to rush through these next couple of questions. How do you think the expanding first response toolkit can be a helpful resource to people in the field? So this goes to E or Ann. So I will start with Ann since E just talked.
I think E kind of touched on this. When I was starting out in 2018, this would have been enormously helpful. And so I think just having a central clearinghouse for information, just to like spark your memory, like I wouldn't have thought about that, or to build momentum or show momentum to maybe some resistors that in your community say like, well, look at this toolkit. This is what other communities are doing. Look what they're doing in San Francisco, type of thing. I do love part of my job that I love the most is talking to folks around the country, because I always learn something from engaging with them. But it also is a huge tax or time consumption of my job as well. So I think having a place where folks can go and be like, oh, this is some best practices around hiring or training, or how to do a community needs assessment, and then leaving that opportunity for folks to reach out to the contributors of the toolkit, and if the contributors have space and capacity to do some one-on-one Zooms, I think that would be awesome.
Yeah, I don't know that I have much to add, except that like you don't know what you don't know, right? And so when you have the toolkit, it identifies all these things that you would stumble upon. Like Deanna was saying, if we'd had it, we could have just followed it instead of constantly really, oh, we didn't do that, we didn't do this. And one of the things that I love about the toolkit is the part we contributed to, not to be self-serving, but we did, is just so thorough because it talks about wellness of your employees and things that often get overlooked in these kind of toolkits that are so essential, right? When you've supported a team that is doing work in the field like this, you have to take care of their wellness or, you're gonna fall apart. So I just think this toolkit helps to remind people of all the things you need to take care of when you're planning with these things. And to the point about legitimacy that Anne was saying, I know I've experienced that a lot, that people they dismiss your ideas and tell you like, oh, look, Council of State Governments has written a toolkit on it. And it's like, oh, okay, this can't be so crazy. I think especially for NCST, we're known for being like a little bit far out, right? Which we love, that's who we are. But when we can say like, oh, like people across the country are doing this work, it helps to make the case for it, for raising money for it and getting institutional support.
Thank you. Yes, we've got the same questions often about how these programs operate from people who are nervous about them, and the toolkit has been helpful in being like, here's the evidence, please stop asking. So last question for the group is, how can we carry these changes forward to support community responder programs and expansion of crisis systems? Like, what will the barriers be for doing this work or expanding this work? And what challenges might exist to expanding this work? And anyone can answer, popcorn style.
I'm happy to get started just thinking about some of the more like the barriers. Which is, again, what I've seen before. Like, I think they're really entrenched barriers to keeping community from meeting their own needs. And I think we have to be really, when we identify those, we have to not just work around them, but actually work to push them away. So there actually may be regulatory barriers in individual states. I'm not sure if there's stuff on the federal level that needs to be addressed, but I think that we might need some policy work around that. My big concern with kind of community responder models is, as I've said repeatedly now, like NCST and the work we do nationally through the collective is all about community empowerment. And I just wouldn't want community responder models to kind of become a new way of like occupying Black and brown neighborhoods, right? Like this, the value in any, we're moving away from that world, right? We want agency in neighborhoods. And so I just want these models to be an opportunity, again, to invest in the infrastructure within a neighborhood, rather than just having like low wage jobs for the people who live in the community and they're not really being in control of what's happening.
Yeah, and I would just also add that just in terms of getting collective buy-in, I mean, one, just a way of being able to get more folks to buy into this frame and the idea of community responder programs, right? That we have to expand our work to more audiences. I think developing more toolkits, doing more webinars, funding this work, in multiple jurisdictions across the country becomes extremely important. Getting buy-in from law enforcement, judges, elected officials, like every opportunity that I get, to be able to talk about our community responder model, first in terms of in terms of violence reduction strategies, and now in terms of OD response, we try to take advantage of those. And again, like law enforcement, like buy-in to this particular, when we first started, like kind of NCST, they literally called us the Hug a Thug program. And it took us about 3 years to really earn the respect, of law enforcement, for them not seeing us just as, snitches, basically, coming to them, putting our high-risk intervention team and workers in harm's way by giving intelligence that in some cases law enforcement couldn't do nothing with, right? Because there's a pretty high threshold in terms of arrest and prosecution. After about 3 years of us working together, and they saw that that we were able to go into neighborhoods and intervene and mediate conflicts to a peaceful outcome, because they didn't have enough, evidence or a witness to be able to correlate, a charge. Now they call us, and it's a one-way relationship in terms of intelligence. They give us all the intelligence about what's happening and don't even expect anything in return. Because they really see community as a true partner in terms of violence reduction. So I think getting more law enforcement and governmental buy-in on this collective frame, will help us to advance this work.
Akila's right about that idea around buy-in from other more traditional first responder systems. When I have had the opportunity and privilege to work with other communities, hands down, one of the biggest places of resistance that we do see can come from the police union, right? That leadership. Generally, when you're talking to patrol officers, they say, no, this is not work that we signed up to do, right? This isn't the right situation for me as a uniformed cop to be going into. But until there's somebody else, I'm going to keep getting these calls dispatched to me, right? But we see this with what's going on right now up in Portland, Oregon, with the potential expansion of the Portland Street Response Project. We are at times up against cultures that include inflammatory slides in their trainings, right? That's the big thing that's hitting the news here locally right now. And so, it's not saying that we have to, or that we can even ignore those more traditional resources. We have to accept that there's going to be that resistance there, and to be willing to engage with the people that most vehemently disagree with us in order to find that common ground. If we're going to enact real change, which is what we're talking about with a lot of these community responder programs, then we can't shy away from the conflict, and we can't shy away from those hard conversations. We need folks who are willing to go out and do the work on the streets, but we also need people who are willing to hold our elected officials accountable, who are willing to get up and say things that are unpopular, and that challenge what we consider, to be the norm, right? To confront the morality that we apply to things like homelessness or substance use. I don't know. I could keep going for this, on this forever, but really, be willing to get in the fire. That's one of the really big things that is going to keep this momentum moving forward. Have those uncomfortable conversations and sit with the people that disagree with you.
Absolutely. What everybody's been saying, I think that just putting in the back of your mind that you need to build a program off of the population, the functionality of the population you serve. I think a lot of times people sit around in a room and build a program, and then they get disappointed when they feel like your folks aren't going to treatment and being successful after 15 days, or your folks are doing this, that, and the other, because they're expecting individuals to have functionality that if there's a bathroom, they should just go to the bathroom. Why would they go in there and shoot up? So really keeping that in mind and making sure that people at the table that are building the programs understand the population that they're serving. Keep an eye on your budget. Like, powerful plays are made at the budgetary level. When you see your budget being cut and other budgets not being cut, you just got to keep an eye on that, even if it's not in your comfort zone. That is where the power is. And then unions. So it's nothing that you can, you want to stick your head in the sand and and never come up again. But I'm working in a police department. I don't know if you've seen people walking back and forth, but my crew team is represented by a union. The officers are represented by a union, and the sergeants are represented by a union. So oftentimes you feel helpless when the work that you're doing and the passion that you have is being negotiated by folks that don't even understand the work that you're doing. But you just have to hold people accountable and start pushing against it and show up to those meetings, as mind-numbingly painful as they can be.
Thank you, everyone. And this concludes our panel. Thank you, everyone, for sharing your insight, both in this panel discussion and for the production of this toolkit. Now we'll pass it to Sarah to take people's questions.
Thank you so much, everyone. So one of the questions is actually a really practical piece that we haven't gotten to yet. So how do you actually prepare staff before they go into the field? Like, how do you train people to be first responders in these new, these new types of programs? So I know any of you could answer this. Okay, Akila, you'll go first.
Sure. For years, I've, worked with a couple of different groups that have done exceptional trainings around prepping residents as public safety professionals to address violence in communities. And just to name a few, the Professional Community Intervention Training Institute, Dr. Akil Bashir, runs one of the best community intervention trainings in the country. You have organizations like Cure Violence, which is works through a public health frame and model. You also have, organizations like Advanced Peace with Devon Bogan. There are multiple organizations out there that train folks on how to approach this work, and that also utilizes systems of like andragogy and transformational education. That's one of the systems that we use at NCST, because many of the folks who come to this work, again, they bring their full selves to it. They bring all of their traumas and everything as well. And so we like to see this work as two-pronged, right? That it not only builds the efficacy and the skill set and builds off of the lived experience of those who are providing it, but also it helps them to address, the traumas in their own life, so that they can continue to, be a model, for others around them. Yeah.
Thank you. I think that really gets to the wellness component, because first responders often do have secondary trauma. How can we incorporate that piece? Tim or Ann, did you want to speak to the training that your teams do?
I think what I would add to what Akila's mentioned is looking to the community partners that you're going to be working alongside, and consider how those community partners can contribute to the education and the training for your responders with these programs. One thing that we've seen with Cahoots is that when we, for instance, do a skills trade where we have folks go and do a de-escalation training for a community partner, that community partner can then come in and do an in-service with us where we're learning about trafficking or trauma-informed response for people who've experienced sexual assault. When we take the time to learn from each other within the community, inherently we start to look at how else we can partner and how else we can serve the folks who are accessing both of those services. So really, in as much as there are national experts, there are also folks within your own community who are doing this, who really know what Eugene or Brooklyn or Olympia really need. And that merits recognition and celebration as experts in your training process for your responders too.
Thanks so much. We have another question. So we've talked a lot in broader terms about stakeholders, but specifically what people or organizations should you talk to help plan for a community responder program? And maybe I'll just direct this towards Ann, then E.
Sure. I mean, I would definitely include the fire department and the hospital, folks that are already responding or serving this population that you want to divert. So if you want to divert folks from the hospital or from the jail, talk to those types of stakeholders. And then, we did a vast stakeholder group. We made sure we had forums where people felt safe speaking up. So we had forums for our business community that were separate from anybody else, because there was so much friction between the business community and housing advocates. And then we had forums for service providers where they really, like Tim said, hey, we're here, we're the brick and mortars, we're doing this work. Don't discount us, tap into us. So we did a wide variety. I think it would just depend on your community and what the population you're serving. They're serving a very different population in Newark. The population we're serving, majority in Olympia, is a houseless population. So encampments, those types of areas.
Yeah, I think similar to what Ann was saying, definitely the police department and EMS we have an Office of Violence Prevention in Newark. We worked with or one of the stakeholders. We pulled together all this kind of service providers who've been working in recovery for a long time, health department, but the most useful stakeholder were the people who use drugs, right? When we actually got folks who are actively using drugs and are experiencing OD and with people who experience OD, which is the focus of our project. They gave us by far the most useful information, and also where they just couldn't believe that we treated them with humanity and were interested in their opinions and, welcomed them into our space and just treated them like people who are experts, and they are experts, and we compensated them for their expertise. And they were definitely the most, and we did street interviews too. And those were probably our most useful stakeholder group, but all the usual suspects. And then, you step into all the expected territorial issues too, for sure. And I wanted to just quickly say one more thing about the training question, because I think that's probably something people are really focused on. Akila, we see violence and drug use is often interconnected. We don't really distinguish these bodies of work in a way, but our interventionists or our violence interventionists have specific training, but it overlaps with this. But now we're adding, so our team is all they're trained in trauma-informed practices, they're trained in mediation and de-escalation, they're trained in personal safety on the streets. They, as Akila was alluding to, we do intense personal development work with all of our employees. They have all that, but then they're going to get specific training through the hospital, through our hospital partner on just how EMS operates and all the nuts and bolts. And then our statewide harm reduction coalition has been just a wonderful source of support and has done a lot of trainings for us, and will continue to train our team. And one of the things that I love about working with the Harm Reduction Coalition is that even as the programming is so intense about this idea that the only way you should access services, people who use drugs should access services, is through the criminal legal system, that even some of our folks struggle with that, even though they've been harmed by the criminal legal system and conceptually really kind of don't buy into it. They still will say, oh, you need to lock people up to give them help and stuff like that. And the Harm Reduction Coalition has been so helpful for just getting the whole organization to rethink reframe our thinking around people who use drugs and just see them as human beings who deserve to be alive, no matter what their personal choices are. And that I'm eternally grateful to the training that they have given to us and to other partners in the state who are already working around recovery and substance use. And we're still holding on to those kind of zero-sum, very punitive attitudes that are really not conducive to harm reduction. So shout out to that coalition. Thank you.
Thank you so much. Thank you to all of you, such great panelists today, Deanna, Anne, Akila, E, and Tim, for today's conversation, and really for your help and support with the toolkit overall. And thank you to everyone who tuned in and who listened to this conversation. We have a survey, so if you can take a minute to tell us what you thought of this event, there will be a link available on social media, in the chat, and also will be delivered to your email. We really want your feedback to make future Justice Briefing Live series events a little bit better. For the resources, if you pre-registered for today's event, we will send an email with the recording of today's discussion. And I want to again just thank all of the people who contributed to this toolkit: Vital Strategies for their support, Reach Out Response Network, Yale Law School, Radical Imagination Strategies, my colleagues at the CSG Justice Center. And please stay in touch. Feel free to sign up for the Council of State Government Justice Center email list. to learn about future Justice Briefing Live events, and also to see as our toolkit expands. Our goal is to add more program highlights, including some of the programs that you heard today in the future. You can visit us at csgjusticecenter.org. And with that, thank you for joining us today. It has been a pleasure to speak with all of you. Have a pleasant and safe week. Be well, everyone.